Hello, welcome to All Day Academy. Today we are going to talk about hemorrhoids. Around 50% of the US population, both men and women, have hemorrhoids by the age of 50. Although hemorrhoids occur in everyone, they can become large and cause serious problems in about 4% of the general population. Hemorrhoids that can cause problems are found usually equally in both men and women, and their prevalence will peak between the ages of 45 to 65 years old. Hemorrhoids, also known as piles, are swollen and inflamed veins around the anus or in the lower rectum. Hemorrhoids can be classified into internal and external hemorrhoids. Internal hemorrhoids are located above the pectinate line and are covered with cells that are the same as those that line the rest of the intestines. External hemorrhoids, however, arise below the line and are covered with cells that resemble the spleen. Internal hemorrhoids are usually not painful because there are few pain-sensing nerves in the rectum. Bleeding may be the only sign. Sometimes internal hemorrhoids prolapse, in which they enlarge and protrude outside the anal sphincter, and this one may be able to see or feel them as moist pink pads of skin. It can also hurt because the anus is dense with pain-sensing nerves. They usually recede into the rectum on their own. If they don't, they can be gently pushed back into place. In grade 3, which is third degree, the hemorrhoid may protrude past the anal verge without any straining and requires the patient to push them back inside manually. In grade 4 hemorrhoids, fourth degree, the internal hemorrhoid always stays protruded or prolapsed and is at risk for thrombosis or strangulation should the anal muscles go into. External hemorrhoids lie within the anus and are usually painful. If an external hemorrhoid prolapses to the outside, which usually happens upon passing stool, the patient can see and can feel it. Thrombosis, which are blood clots, usually form within prolapsed external hemorrhoids. These can be extremely painful and can also look purple or blue and could possibly bleed. They will resolve themselves in a couple of weeks. The patient may need to undergo surgery to remove thrombosed hemorrhoids if the pain is unbearable. What causes hemorrhoids? Stress can lead a person to hemorrhoids. Hemorrhoid prevalence also increases with age. Tissues that support the veins in the rectum and anus can weaken and stretch with aging. A diet low in fiber and high in processed foods can also lead to hemorrhoids. A low fiber diet or inadequate fluid intake can cause constipation, which can contribute to hemorrhoids in two ways. Number one, it promotes straining during a bowel movement. Number two, hard stools will further irritate the swollen veins. Irritants in the diet, such as strong spices like chili, red pepper, and mustard, can also lead to hemorrhoids. Coffee and alcohol intake can also lead to hemorrhoids. Hemorrhoids can also be caused by increased pressure on the abdomen, lower rectum, or anus, as this can cause swelling of veins around the anus and thus lead to hemorrhoid. Factors that might cause this increased pressure include obesity, pregnancy, standing or sitting for long periods, straining during bowel movements, coughing or sneezing, vomiting, chronic diarrhea or constipation, and holding your breath while straining to do physical labor. Signs and symptoms of hemorrhoid include painless bleedings during bowel movements, where small amounts of bright red blood on the outside of the stools, on the toilet paper, or dripping into the toilet. The bleeding is usually self-limiting. However, one must be cautioned if bleeding occurs because these can be caused by other reasons such as ulcers, diverticulitis, inflammatory bowel disease, and tumors. One may need to seek emergency medical care, especially when the patient is taking blood thinning medications. Person may also experience itching or irritation in the anal region, a constant feeling of needing to have a bowel movement, pain or discomfort, swelling or lump around the anus which may be sensitive or painful, as well as leakage of feces. When does the patient refer to a doctor? When the patient experiences rectal bleeding, the patient should refer to a doctor if the patient is taking anticoagulation medications such as warfarin, clopidogrel, or prasugrel. When the patient experiences lightheadedness and weakness, this may mean the patient may have significant blood loss. Hemorrhoids do not cause abdominal pain. Should this be present with bleeding, medical care should be sought immediately. Prolapsed hemorrhoids that cannot be pushed back through the anus. Thrombosed external hemorrhoids may cause significant pain. Diagnosis of the process include taking the patient's history, physical examination, and endoscopy. Management of hemorrhoids include diet, lifestyle modifications, exercise, medicine, hemorrhoid removal treatments, and herbal medicine. Regular exercise keeps a person's weight in check and makes constipation less likely. It also enhances muscle tone and keeps the digestive tract working. Diet is the best treatment for hemorrhoids. Hemorrhoids result from constipation and straining. Thus, increasing fiber intake softens stools, promotes healthier GI and colon, and prevent constipation. A high fiber diet includes lots of vegetables and fruits including guava and banana, nuts such as almond and cashew nuts, and whole grains. Psyllium husk, flaxseed, and chia seed should also be incorporated into a person's diet. Regular consumption of aloe vera juice may also relieve the symptoms of hemorrhoids. And most importantly, the patient should always remember to drink 6 to 8 glasses of water daily. Foods to avoid include processed foods, meat, excess salt, as this can cause fluid retention and thus swelling in the veins, refined carbohydrates, and dairy products. Warm seat baths are very effective for hemorrhoids. One can mix a few tablespoons of Epsom salt and a half cup of apple cider vinegar in the sitz bath of warm water and sit in for 15 minutes. Repeat this several times a day, especially after a bowel movement, as this can reduce the swelling in the anus and relaxes spasm of the sphincter muscles. Healthy bowel habits. One should use the toilet as soon as you feel the urge to go. Avoid straining. Try not to sit for hours at a time. Once every hour, the patient should get up and move around for at least 5 minutes. A soft cushion may also make sitting more comfortable and ease hemorrhoid pressure and pain. Bathe regularly to keep the anal area clean and be gentle because excessive scrubbing, especially with soap, can intensify burning and irritation. Don't force a bowel movement. When wiping, be gentle. If the toilet paper is irritating, try alcohol-free baby wipes. After bowel movement, wash or clean the anus area thoroughly and dab it dry. Squat and do not sit. This is very, very important. Conventional toilets are highly unnatural. Sitting down to pass a bowel movement puts tremendous strain on the rectum. Squatting instead straightens the rectum and relaxes the puborectalis muscle. Medicines for hemorrhoids include stool softeners or bulk forming agents such as fiber drinks. Avoid laxatives as laxatives can cause diarrhea and this can further irritate the swollen veins. Take paracetamol to relieve pain. Avoid ibuprofen and aspirin as this may cause bleeding. Avoid stretching. Stretching irritates inflamed veins and damages the surrounding skin. This will intensify the itch. To stop itching, inflammation, and pain, apply anti-hemorrhoidal ointment or use a cold pack. Apply ice packs or cold compresses to relieve swelling. Apple cider vinegar, aloe vera gel, coconut oil, Epsom salts, and witch hazels are a few examples of natural remedies that can be used for external hemorrhoids. Reduction of inflammation is the goal of treatment in this condition. One can start with 2 capsules of fish oil 1200 mg daily to help relieve symptoms. Bioflavonoids like phyto-9 are very potent antioxidants and these can help reduce inflammation of the veins. Taking a fiber drink regularly will ensure smooth bowel movement and prevent constipation. Majority of hemorrhoids can be managed with non-surgical methods such as lifestyle modifications and supplements. However, for more advanced clinical conditions, the patient may need to undergo hemorrhoid removal treatments. These include sclerotherapy, rubber band ligation, hemorrhoid stapling, coagulation or cauterization, and hemorrhoidectomy. Hemorrhoidectomy and stapled hemorrhoidectomy are reserved for third and fourth degree of internal hemorrhoids. After non-surgical treatment, the recurrence rate usually occurs between 50%. After surgery, however, recurrence rate is around 5%. Hemorrhoid removal treatments are very effective, but unless dietary and lifestyle changes are made, hemorrhoids may recur.